Hello everyone, welcome back to the channel. So in this video we are going to look about how to choose a department and what are the various scopes, once you specialize in a particular department, what all you can do after doing that MDS in the particular department. Okay, so this video is in no particular order, so just don't think that if I start with some subject it is the first, and if I end with some subject it is the last. So it's a random order. I just give you a brief idea of what are all the things you can do after doing MDS in the MDS departments in various fields. So first let us start with orthodontics. So ortho is one of the most popular field which most of the students they want to specialize in. Okay, so if you look at ortho, what are all the things you can do once you finish orthodontics? Okay, once you come out as an orthodontist, if you see, you can go for consultations. Okay, you can go for consultation. Invariably this comes for all the clinical field. You can go for consultation in all the clinical departments, and apart from consultations you can work with the labs for designing, right? So and you can set up a lab. You can set up a customized orthodontic lab and aligners, clear aligners. Okay, and then there is also specialization in orthodontics, like you can specialize in cleft palate, and you can also work in some specialized centers, and you can also work in college. You can also become an academician if there is a vacancy provided that. Okay, so if you are the person who is looking to earn very smoothly and not to willing to take some risk, the money will come easily. And most of the dentists, they don't do ortho treatment because it is more of concern with aesthetics. So 80% of the times you are going to get consultation. So it is one of the department where you can earn easily, where you are going to get consultations more frequently. Okay, so that is why most of the students, they want orthodontics. Okay, so these are all the things which you can do once you specialize in orthodontics. And if in case I miss something in any department, you can just put it in the comment section, so that the students might they will come to know that there's something like that. So next, if you see, we shall talk about endodontics. So endodontics, if you see, 80% of the people who comes to your clinic will come either with a pain or affected with dental caries. So 80% of the times you are going to get consultations. Okay, endo is one of the department where you will get consultations invariably. Okay, because most of the patients, they come to the clinic once they have pain, or they have they have discoloration in the teeth like caries. So invariably you are going to get consultations you are invariably going to get. And you can also become an aesthetic dentist. What does that mean? You can if like composites and anterior, veneer restorations in anterior, so you can become an aesthetic dentist. And then you can definitely work in colleges. You can do some research in various materials, dental materials available. You can do some research. You can become an academician. And then yes, retreatment specialist. Okay, you can become a retreatment specialist in case if somebody done a RCT, it is a failure, and you can do a retreatment. So retreatment specialist. So you can become an aesthetic dentist. You can work in college. You can definitely go for consultations. So as I said, invariably you're going to get consultations because most of the patients, they come to the clinic with pain. Okay, endo is one of the department where you can earn, where you get more consultations. Okay, so the next department, if you see, perio. So perio is one of the most underrated subject. Is one of the departments where you can do lots and lots of research. Okay, lots and lots of research if you are interested in research. And also you can go for consultations. You can go for flap consultations and implant consultations. Okay, and you can definitely work as an aesthetic dentist here also. In lasers or gingival depigmentation, the procedures which are concerned with aesthetics, you can also work in that manner. And as I said, you can also work in colleges provided the vacancy is available. Okay, and this perio, it has a lot of scope in abroad. So if you are willing to go to abroad, there are certain countries which offer great value for periodontics, so you can choose that also. Okay, so the next department is pedo. So periodontics is one of the department where you need more patience. So patience is very important in periodontics, because if you are a person who you are not that kind of a, you will not be that much amount of patient towards the children, or towards the child is sitting in front of you, then you I guarantee that you don't take periodontics better, because at the end of the day, invariably you are going to get consultation, because the general dentist, they will be a little bit scared to handle a pedo patient, because the pedo patient will, they if they can handle the child might cry, and it might offend the patients who are sitting outside. They will think that this dentist doesn't know to see the patient, so they'll invariably call a periodontist. So at that point of time, you should be you should be patient, and you should know how to handle that child. Okay, so it is one of the department where you need more amount of patience, and definitely you will get consultations for it. Okay, and yes, pedo is one of the department where you do oral surgery, where you can practice endodontics. Okay, and where you can practice prosthodontics as well. So it is more of a multidisciplinary approach. Okay, multidisciplinary approach. So, and again, you can work in colleges, you can also become an academician. So this is what I know about the scope of periodontics. So the next department, if you see, we shall talk about what else is left. PhD. So PhD, you can do a lot of things in public health dentistry, because you can work in some great institutions like ICMR, WHO. You can become you can do a lot of research activities. It is one of the subject, where if you are interested in public health dentistry, you can do a lot of stuffs, and you can work in colleges, because there will be a lot of vacancies for public health dentistry, because only a few dentists come out of it. And of course you are not going to get consultations, but you can do some courses. If you wish, you can do some courses for it, and you can specialize in that. Okay, so the next is oral medicine and radiology. So oral medicine and radiology, you might get consultations, like people, the dentist might ask you what is the radiographic findings of these patients, like you can specialize in a CBCT, you can put a CBCT center. Okay, and then you can there is a fellowship for it, like oral oncology, fellowship for it like oral oncology. Okay, and then you can manage certain TMJ disorders, TMJ disorder managements, right? So as far as I know, there is a lot of scope for radiology in oral medicine. So if you want to take oral medicine, then you have to take more interest on radiology. So there are a lot of things you can learn in radiology, like CBCT, PET scan. So they're all becoming up, and definitely that's a scope for it in the future. So the next is oral pathology. Oral pathology, if you see, oral pathology is one of the subject where you can work as an see, oral medicine, oral pathology, PhD. There is a lot, they are more dependent on the college. You can become an academician rather than a consultation. You can go for consultation, because there's mild chances you can go for consultations, unless and otherwise you know something which you have learned in undergraduate, or you have learned in some clinic. So invariably you are going to depend on college. So make sure you're going in the right path. So oral pathology, you can become an academician, and then you can set up your own lab. Okay, you can set up your own lab, and you can give your diagnosis. If you are that efficient and confident, definitely go for setting up a lab, because people will definitely refer to your lab, and they will try to get consultations, and you can do a lot of research activities here. And you can specialize in oral pathology, like there is something called as forensic odontology. I have little knowledge about the forensic odontology, because there is only a few colleges regarding this forensic odontology. So if you are interested in that, you can refer that to your friends or seniors who is doing or who has done or specialized in oral pathology. Okay. So the next department we shall talk about prosthodontics. Prosthodontics is one of the departments. Again, perio, prosto, surgery, they all can put implants, right? So prosto is one of the departments where you can earn more money, and you know, you can definitely get a lot of opportunities for implants. Okay, so all on 4, all on 6, you know, they are more coming up, and full mouth rehabilitation. So you know, the implant is going to play a significant role in prosthodontics. You can do a research in various dental materials. If you are interested in research, you can work in colleges. Okay, so prosto is one of the department where you can earn a lot of money, and it is more you know, the most important part of prosthodontics is implant. So if you are willing to specialize in prosthodontics, make sure that your colleges you know, they are putting more implants. Okay, so what else? Yes, and last subject is going to be the oral surgery, oral and maxillofacial surgery. Oral and maxillofacial surgery, you know, you don't take this department unless and otherwise you have a passion for it. Okay, so again I'm saying, you don't take this department unless and otherwise you have a passion for it. You can go for consultations. You know, this is one of the department where you have a broad opportunities, provided that you get, you know, you have to do a lot of things to actually shine in OMFS. Okay, there's a lot of fellowship like head and neck oncology, head and neck and cleft palate and lip aesthetic. So you can do fellowship in these courses, and you know, you can manage trauma patients. You can work in some hospitals, you can go for consultation in hospitals. You know, there's a lot of scope for OMFS, provided that you are in the right institution and the case flow is good. Always try to join a college where it is attached to a medical college. The dental college attached to a medical college, you know, you get a lot of scope, you get to see a lot of cases in oral and maxillofacial surgery in particular, because if it is not linked to a medical college, you might not aware of a lot of procedures, or you know, you might miss certain cases. Okay, so this is our various scopes in all the departments, and if I miss something, or if you know something other than this, just type in the comment section. And I always say, always choose the department. Okay, always choose the department over the college. Okay, always choose the department over the college at any point of time, because the department, you're going to be a periodontist in any college. Okay, and for example, if you are interested in prosthodontics and you are getting periodontics in a very good college, if you choose periodontics in the college, that is the worst decision you have taken, because you know, you are not going to shine in that. You are going to practice that for the next 20 years, and you know, that might not end well. So choose the college over the department. Choose the department over the college anytime. Choose the department over the college, but not the the college which has very low cases, or you know, very less patients. You know that, right? You just analyze that. If the college you think is very less or very minimal flow of patients, then you can shift to other department. But always choose the department of the college, because you're going to practice that for next 20 years at least. So again, thank you for watching this video. Hope you are all doing great, and have a great day. Cheers.